Did you know that one simple habit, something you repeat every night without thinking, may be placing quiet pressure on your heart? Many older adults tell me they feel fine, yet their heart works harder while they sleep than during the day. This happens because certain sleeping positions, along with a few daily habits, can lower oxygen, raise nighttime blood pressure, and force an aging heart to push against resistance it never deserved. The surprising truth is this: the danger is not a medication, not a meal, and not a diagnosis. It is the way your body settles, rests, and recovers. Recent heart health research confirms what I've seen in my clinic for years. Subtle changes in posture and nighttime breathing can quietly exhaust the heart, especially for those over 60. These habits feel harmless because they build slowly, but your heart experiences every moment of strain. No pain, no warning, just a tired heart working long after you've gone to sleep. And before we go any further, I want to make sure you never miss another message meant to protect your heart and support your independence. If you haven't subscribed yet, please take a moment to tap the subscribe button and turn on the notification bell, because each week I share simple, gentle tips crafted for older adults who want to stay strong, confident, and safe. And to help me understand you better, please comment the number 9 if you're ready to continue. Comment 0 if something feels unclear. Your feedback truly helps me shape these lessons for our community. Now, here is the part most seniors never expect. The most dangerous habit is not found in the gym, not on your dinner plate, and not in your medicine cabinet. It is found on the very place you trust the most, the bed where you sleep each night. And once you see how this habit affects your heart, you will never look at your nighttime routine the same way again. 1. Sedentary lifestyle. Sitting too long. Your heart is an incredible organ, yet it becomes more sensitive as you move beyond 60. That is why even simple habits, like sitting for long periods, can influence how well your heart functions each day. Your heart can age faster than you expect when your body stays still too long, and many older adults do not realize how quickly circulation slows when they remain in one position. This habit carries a danger score of 8 out of 10 because it slowly increases pressure inside the cardiovascular system and quietly strains an aging heart over many years. It feels harmless because it builds quietly, but inside the body, blood flow changes in ways that challenge a heart that deserves rest. When you sit for an hour or more without standing, blood begins to pool in the lower legs. This increases the pressure required for your heart to return that blood to the chest. Over time, the heart must pump harder just to maintain normal circulation, and that extra effort becomes tiring for a heart that has already served you faithfully for decades. Poor movement also allows inflammation to linger around the blood vessels, which gradually encourages plaque buildup. These changes do not happen overnight, yet they accumulate in ways many seniors underestimate. To help you understand this more clearly, let me share a brief example. Here is a simple story that reflects what I often see in my clinic. Leonard, age 74, enjoyed watching television every evening. He usually sat for 3 or 4 hours without standing. After several months, he noticed swelling around his ankles and a heavy feeling in his legs. When he came in for an evaluation, we discovered early signs of mild heart failure, caused partly by slow circulation from prolonged sitting. His condition improved once he made consistent movement part of his routine. There is a gentle, practical solution you can begin using today. Follow the 30-3-1 rule. Every 30 minutes, stand for at least 3 minutes. Then take one slow lap around the room. This simple pattern keeps blood moving, lightens the heart's workload, and improves your overall stability. You do not need intense exercise. You only need steady, regular movement that supports your heart with kindness. If you also find yourself sitting for long periods, please comment "I do" below, because your voice helps me understand how to guide this community better. And remember this as we continue. Sitting too long weakens the heart slowly over years, but the next habit can raise pressure inside the heart within just a few hours. 2. High-salt eating, extra pressure on the heart. Many older adults are surprised by how strongly salt influences their heart. Just 1 teaspoon less each day can noticeably lower blood pressure within a week, giving your heart a calmer, easier environment to work in. This habit carries a danger score of 9 out of 10, because excess sodium raises internal pressure quickly and forces an aging heart to work harder than it safely should. The risk grows with age as the body becomes less efficient at removing sodium and fluid. People over 60 are especially sensitive to salt because kidney function naturally declines over time. Even small increases in sodium can create unwanted shifts in fluid balance. When the body retains too much water, blood volume rises. This extra volume expands the pressure inside the arteries, and the heart must push with more force to move blood forward. Over months or years, this effort can gradually enlarge the heart's main pumping chamber. An enlarged heart becomes weaker, less flexible, and more prone to failure during times of stress or illness. Let me share a short example that reflects what I commonly see. Here is a simple case from my clinic. Ethel, age 79, had enjoyed salty soups and pickled foods since childhood. As she got older, she noticed swelling around her ankles and occasional pressure in her chest at night. A routine exam showed elevated nighttime blood pressure, caused in part by long-term sodium sensitivity. When she reduced her salt intake and replaced it with herbs and citrus, her swelling improved, and her blood pressure slowly stabilized. There is a gentle way for you to support your heart starting today. Use herbs like rosemary, garlic, dill, lemon zest, onion powder, or smoked paprika to replace salt in your meals. These flavors keep your food enjoyable while reducing the strain on your heart. Staying hydrated also helps your kidneys remove sodium more effectively. If you think you may be eating too much salt, please comment "salt" below so I can understand how to guide this community better and share more heart protective tips. And as we move forward, remember this: reducing salt lightens the load on your heart slowly over time, but the next habit can damage blood vessels from the inside, even when your diet seems perfectly balanced. 3. Sugar and processed foods, hidden strain on the heart. Every spoonful of sugar is a small step that pushes your heart closer to premature aging, especially when those sugary choices become daily habits. Many older adults believe they consume only a little sugar, yet hidden sugars appear in more foods than most people realize. This habit carries a danger score of 8 out of 10 because sugar quietly fuels inflammation, disrupts blood lipids, and accelerates the stiffening of arteries that support your heart. Sugar hides in pastries, packaged snacks, sweetened teas, flavored yogurts, and bottled fruit juices. Even foods that seem healthy can carry enough added sugar to strain the cardiovascular system. For adults over 60, the body processes sugar more slowly, leading to longer periods of elevated insulin. This prolonged exposure encourages inflammation inside the vessel walls. Over time, inflamed vessels become sticky, allowing fats to cling and harden. Elevated triglycerides follow, creating the ideal environment for plaque buildup and narrowing of the arteries. Here is a brief example to help illustrate the pattern. This simple story reflects what I often see in real patients. Harold, age 68, enjoyed sweet iced tea every evening. He believed 1 glass was harmless, especially because he stayed active during the day. After several months, he noticed unusual fatigue and mild pressure in his chest when walking uphill. A blood test revealed elevated triglycerides, driven partly by his nightly sugar intake. When he reduced added sugars and replaced his evening drink with herbal tea, his triglyceride levels slowly improved. There is a compassionate, practical way to protect your heart without feeling deprived. Aim to limit added sugars to about 25 grams per day, focusing on whole fruits instead of processed desserts. Choose foods with short ingredient lists, and watch for hidden terms like corn syrup, fructose, or evaporated cane juice. These simple steps can ease the burden on your heart, stabilize your energy, and support healthier circulation. If you have ever tried to cut back on sugar but found it difficult, please comment "sugar" below, because your experience helps guide the topics I choose for future lessons. And as we move forward, remember this: small dietary changes can lift pressure from your heart over time, but the next habit can disturb your heart while you sleep, even when your diet is perfectly controlled. 4. Snoring and sleep apnea. Nighttime stress on the heart. Every loud snore can act like a sudden udar of pressure against your heart, especially when it happens repeatedly through the night. Many seniors consider snoring a harmless nuisance, yet it often reveals deeper breathing interruptions that place real strain on an aging cardiovascular system. This habit carries a danger score of 10 out of 10, because sleep apnea can sharply reduce oxygen, destabilize heart rhythm, and raise nighttime blood pressure in ways that threaten long-term heart health. Adults over 60 face nearly double the risk of sleep apnea. As throat muscles loosen with age, the airway collapses more easily during sleep. Each time airflow stops, oxygen levels fall. The heart reacts quickly, increasing its rate to compensate for the sudden drop. These repeated surges create stress within the vessel walls and force the heart to work harder at a time when it should be resting. Nighttime blood pressure rises as the body fights to restore airflow, and this pattern raises the overall risk of stroke, arrhythmias, and heart failure. Here is a brief example to illustrate the pattern clearly. This story mirrors many cases I see in older patients. Loretta, age 72, woke most mornings with headaches and a heavy, unsettled feeling in her chest. She believed it was simply part of aging until a sleep study revealed frequent episodes of sleep apnea. Each episode caused her oxygen level to drop, forcing her heart to speed up repeatedly through the night. When she adjusted her sleeping position, elevated her head, and focused on light weight reduction, her morning symptoms gradually improved. You can begin supporting your heart tonight with a few simple adjustments. Elevate your head by 6 to 8 inches to help keep your airway open. Sleep on your left side to reduce pressure on the heart and increase airflow. Even a modest 5% weight reduction can significantly ease nighttime breathing for those with sleep apnea. If you snore or suspect you may have sleep apnea, please comment yes or no below, because your response helps me decide which heart protective topics to explore next. And as we continue, remember this: sleep can strain the heart quietly in the dark, but daytime stress and emotional tension can pressure your heart just as intensely, even when you are fully awake. 5. Stress, worry, and anger. Emotional pressure on the heart. Emotions do more than tire your mind. They can place real physical pressure on your heart, sometimes enough to make it feel as if the heart could break. Many adults over 60 carry long lists of responsibilities, worries, and private concerns they rarely share. This habit carries a danger score of 7 out of 10, because emotional strain increases hormonal stress signals that tighten blood vessels and force the heart to work harder during moments when calm would be safer. Older adults often worry about finances, health changes, or family matters. These concerns activate the body's fight or flight response more easily with age. When stress hormones rise, the vessels become narrower, and the heart must push blood through a tighter space. This raises heart rate and blood pressure, sometimes within minutes. Over time, repeated stress can weaken the heart's resilience and contribute to uncomfortable symptoms like chest pressure, dizziness, or shortness of breath. Let me share an example that mirrors what I see in my clinic. Here is a brief story showing how emotional stress affects the heart. Gerald, age 76, spent months worrying about medical bills and changes in his retirement income. He slept lightly, woke often, and felt tension in his chest during the day. One evening, after a particularly stressful phone call, he experienced a sudden spike in blood pressure that brought him to the emergency room. Thankfully, he recovered well, but his episode was a clear reminder of how emotional strain can push the heart toward danger. You can begin protecting your heart in gentle, simple ways. Try the 4-7-8 breathing method. Breathe in for 4 counts, hold for 7, then release slowly for 8. This pattern relaxes vascular tension and helps lower heart rate. Writing a short journal entry each evening also gives your mind a place to release worries before bedtime. If you have ever lost sleep because of stress, please comment "stress" below. And if this information feels helpful, you are welcome to like or share it with someone who may need encouragement today. And as we continue, remember this: emotional pressure can strain your heart from the inside, but the next habit is quieter, stealthier, and begins inside your mouth, long before it reaches your heart. 6. Poor oral hygiene. Hidden inflammation affecting the heart. Gum inflammation can open the door for harmful bacteria to travel through your bloodstream and reach your heart, creating stress your body never intended to handle. Many older adults think bleeding gums are simply a normal part of aging, yet these small signs often reveal deeper inflammation. This habit carries a danger score of 8 out of 10 because ongoing oral inflammation increases the risk of heart disease by quietly damaging blood vessels over months or even years. Bleeding gums are especially common in older adults because the tissues become thinner and more sensitive with age. When brushing causes discomfort, people tend to clean their teeth less thoroughly. This allows bacteria to gather around the gum line. Once bacteria enter the bloodstream, they can irritate the lining of the vessels. Inflamed blood vessels become less flexible, making it harder for the heart to pump blood efficiently. Research shows that chronic gum disease may increase the risk of heart complications by 20 to 30%, especially in individuals already living with high blood pressure or diabetes. Here is a brief example that reflects what I often see in clinical practice. This simple story shows how oral health and heart health can connect. Nancy, age 81, had dealt with mild gum bleeding for years. She brushed gently, thinking it would protect her sensitive gums. Over time, she developed persistent swelling in her legs and occasional chest discomfort. A dental exam revealed advanced gum disease, and her cardiac tests showed progression of underlying coronary artery disease. Treating her gum inflammation and improving her brushing routine helped reduce overall inflammation in her body. There is a gentle, effective way to protect your gums and your heart. Flossing once each day removes bacteria from areas a toothbrush cannot reach. Using a soft bristle brush and brushing for at least 2 minutes also supports healthier gums. These simple habits reduce inflammation and lower the amount of bacteria that may enter the bloodstream. How many times do you brush your teeth each day? 1, 2, or 3? Please comment below because your responses help me guide this community toward practical, heart-healthy routines that support long-term wellness. And as we continue, remember this: Oral inflammation can quietly strain your heart from the inside, but the most dangerous habit of all appears when you drift into sleep, affecting the heart when you are least aware. 7. Harmful sleeping positions. Silent nighttime pressure on the heart. The way you position your head, back, and chest tonight may determine whether your heart recovers or quietly weakens. And many seniors never realize how strongly posture affects nighttime circulation. Simple changes in sleeping position can alter oxygen flow, shift pressure inside the chest, and influence how hard your heart works while you rest. This habit carries a danger score of 10 out of 10, because the wrong posture can strain the heart for hours without waking you or causing noticeable symptoms. There are 3 sleeping positions that place the greatest stress on the cardiovascular system. First, lying flat on your back with your head too low reduces airway space. Less oxygen enters with each breath, forcing your heart to beat faster throughout the night. The heart should rest during sleep, yet this position makes it work overtime. Second, sleeping on your right side for long stretches increases venous return to the heart. Older hearts are often stiffer and less flexible, so this added volume becomes a burden, raising internal pressure. Third, curling tightly into a fetal position compresses the chest and reduces lung capacity. Air cannot move freely, and the heart struggles to maintain even, stable rhythms. Here is a simple example to help illustrate how posture influences heart function. This story reflects what I frequently see in older patients. Ellis, age 75, woke most mornings feeling tired despite sleeping 8 full hours. He believed it was normal aging until a sleep evaluation showed he spent most of the night curled into a tight, fetal position. The position restricted his breathing, lowered his oxygen levels, and placed steady pressure on his heart. After switching to a wedge pillow and practicing a more open sleeping posture, his mornings gradually became clearer and more energized. The good news is that you can support your heart tonight with gentle, practical changes. Elevate your upper body using a 6 to 8-inch wedge pillow to improve airflow. Relax your shoulders, open your chest, and allow your arms to rest comfortably at your sides. These adjustments help your heart work with ease rather than strain. If you have ever woken up tired despite a full night's sleep, please comment "morning" below, because your experience helps shape the lessons I create for this community. And remember this as we move forward. These habits do not act alone. They combine, layer, and slowly weaken the heart in silence. Aging does not take away the strength of your heart. It simply asks you to care for it in the right way each day. Your heart has carried you through decades of memories and challenges, and it still responds beautifully when you give it gentle support. Even small adjustments can reduce lifelong strain and help your heart work with greater comfort and confidence. Let's bring everything together. We explored 7 habits that quietly weaken the heart over time. Sitting too long slows circulation and forces your heart to push against resistance. Eating too much salt raises blood pressure and increases fluid load. Consuming excess sugar fuels inflammation and encourages plaque to develop. Snoring and sleep apnea lower oxygen levels and repeatedly stress the heart at night. Emotional stress tightens blood vessels and pushes your heart into unnecessary high alert. Poor oral hygiene allows bacteria to enter the bloodstream and inflame vessel walls. And harmful sleeping positions restrict breathing, making your heart work harder during the hours meant for healing. Although these habits may seem unrelated, they often combine in daily life. They overlap, amplify each other, and create silent pressure your heart carries for years. But here is the hopeful truth. You do not need to change everything at once. Change just one habit each week, and your heart will begin to improve in noticeable ways. You may experience steadier breathing, calmer mornings, better sleep, and more comfortable energy throughout the day. What matters most is your willingness to begin. And by learning how these habits affect your heart, you have already taken the first step toward protecting it. Share one thing you learned today and will apply tonight. If this video was helpful, comment 9. If not, comment 0. Don't forget to like, share, subscribe to receive more Senior Health Life content.